Upstate Medical University in Syracuse, New York, invites you to be the informed patient with the podcast that features experts from Central New York's only academic medical center. I'm your host, Amber Smith. Sleep problems are common in adolescence. A public health researcher at Upstate has been studying the association between sleep problems and problems with normal biological processes that may be connected to depression or other medical conditions. Jason Carbone is a social worker and an assistant professor of public health and preventive medicine, and also the director of research in the Department of Family Medicine at Upstate. Welcome to the Informed Patient, Dr. Carbone.
Hello, thanks for having me.
You had papers published in both the journal Psychoneuroendocrinology and the Journal of Affective Disorders. And before we get into the details of this research, I'd like to have you define some of the terms that show up. What is biological deregulation?
Yeah, so in order to sort of understand what biological dysregulation is, you have to look at it through the lens of a larger theory. So my work uses what's known as allostatic load theory, and it dates back to the 90s, and it's this idea that chronic exposure to stress results in negative health outcomes. Sometimes it's referred to, the process as how stress gets under your skin. The idea is that we all respond to stressful situations kind of mentally and then physically, right? We have a physiological response to stress, whether that is a stressful meeting, it could be something like experiencing a car accident, any type of daily stressor. But after that stressful event ends, our body returns back to a baseline. So during the stressful event, our norepinephrine, epinephrine, and then after a little bit of time, cortisol, those levels elevate. But once the stressor is removed and some time has passed, we return to kind of our baseline normal setting. What allostatic load theory says is that over time, chronic exposure, lots and lots of stressors piled on top of each other, changes that baseline so that we don't return back to that normal, healthy baseline. Those biomarkers become elevated. And that's what that dysregulation is, kind of having biomarkers of stress be elevated and out of where they need to be in order to be healthy. And over time, those dysregulated biomarkers lead to chronic health conditions, right? Such as hypertension, diabetes, or in this case, what we looked at here was depression.
Okay. And does it affect sleep?
Yes. Well, yes and no. So that's part of what we trying to look at, trying to understand is the relationship there. There's a relationship there, but for example, both these studies are cross-sectional. So there's a question about what direction that goes. And we hypothesize that it's really bidirectional, right? Poor sleep can lead to dysregulation, but also dysregulation leads to poor sleep. Think of the example of when you're stressed out about something and you can't sleep, you're thinking about it, right? The stress can lead to sleep dysregulation, and then that sleep dysregulation can sort of mess up your biological processes, for lack of a better term, and then lead to dysregulation. So there's like a feedback loop there that occurs. They impact each other.
Now, do we need to understand immune metabolic, what that means?
There's a short answer and a long answer. The short answer is that's a term that we use, or you see it a little bit in literature, but we more or less came up with as a label for a specific type of dysregulation. So to understand this, I think, one of our papers where we use that term, you have to understand kind of what we were doing and the thought behind this. And we used a model called latent variable analysis. So it's kind of complicated, but the way I like to explain it is, I have two small kids, so we have Legos in the house. And if you think about a bucket of Legos, there's lots of different Legos, different shapes, different colors, different purposes, and you can pour that bucket onto the floor and you can put them into piles, and you can sort them in different ways. Sort them by color, by shape, by color and shape, color, shape, purpose, lots of different kind of permutations of that. That's what we're doing in this type of analysis. We're taking biomarker values, so from things like heart rate, cholesterol, immune biomarkers, and others, and we're trying to understand these latent or underlying patterns in those biomarkers in individuals. And that's where the immunometabolic dysregulation comes from. One of those profiles show of when we group people together, we see a group of people that have high levels of dysregulation in immune biomarkers and metabolic biomarkers. So there's a connection, it seems, there between those. And what we found is those who have those high levels, then that is associated with negative health outcomes specifically.
Now, cancer and heart disease and high blood pressure, these are things we aren't used to hearing about in adolescence. What made you want to focus your research on this population?
So some of my other research is with this population, particularly when we were looking at the sleep side of it. My colleague, Melinda Casement, who is a sleep researcher at University of Oregon, we were looking at this and saw some of the other literature and saw this explored in older populations and adults and thought, well, we wanted to see, is this true for younger people, right? Is this outcome, is this association present among adolescents and emerging adults, to try to understand what that relationship is, but also to think about how we intervene upstream, right? So one of the challenges with allostatic load related research is you're also often looking at it in older adults, you're looking at it kind of at the verge of or when you already have a disease outcome. So if we can look at this in younger populations to see, okay, is there dysregulation present before there's a presentation of a disease? Maybe that's an opportunity to intervene at an earlier state in order to prevent the eventual development of a disease outcome.
So it's already been established that sleep problems are related to cancer, heart disease, high blood pressure in adults. Is that right?
There's some research around that. Specifically, when we were looking at depression, there was a couple of studies in particular that we saw that were recently published that something similar to what we did, but with adults. And so then we were saying, okay, well, does this hold true for teens, adolescents? The other piece of the puzzle here is that emerging adults, that's a time of lots of change, right? Physical change, physical development. So trying to understand what are the risk factors, what are kind of the impacts of stress at that point in time that could have longer term outcomes. There isn't a lot of research in the allostatic load research space around that, but thinking about that I think is important because we don't know, are youth particularly sensitive during that period? So trying to understand that is another goal of this work.
This is Upstate's The Informed Patient podcast. I'm your host, Amber Smith. I'm talking with Jason Carbone, who is a social worker and an assistant professor of public health and preventive medicine and director of research for the Department of Family Medicine at Upstate. Can you tell us about where you got the biomarker and sleep data for the 16 to 24-year-olds that you analyzed?
Yes. So the data comes from something called the National Health and Nutrition Examination Survey. It is a national study sponsored by the Centers for Disease Control and Prevention. They have been doing this study for many years. There's multiple cohorts of it, and there is survey data. There is this biomarker data that we use. It's a whole very large, intensive project, and the data is publicly available. So we were able to draw on that data set and utilize that for this work. It's one of the few publicly available data sets that has biomarker data that's useful for this type of research. So it's very valuable for this type of work.
How many individuals were represented?
About 1,000. The samples for the two studies are a little bit different because we had to pull from different years, in part because there's standard questions that they ask, and then they change some questions for each group. So some of the sleep questions were different, but around 1,000 for each study. And that is actually weighted. It's a nationally representative sample, so it's weighted to represent a much larger population of the US.
Now, what biomarkers did you center on, and why did you choose those particular biomarkers?
The biomarkers we chose were based on, one, the availability of the biomarker in the data set. So that's always a limitation when you're using an existing data set. So that was one of the reasons we chose them. The other was based on the existing literature and other work in allostatic load, right? So we classified them into a number of systems. So you have we did systolic and diastolic blood pressure for cardiovascular. We had measures of lipid metabolism. We had measures of glucose metabolism, and then measures of the inflammatory system as well. So other examples are, HbA1c, fasting glucose, CRP, white blood cell count. Again, some of these biomarkers are more commonly recognized by people. They're the type of things that your primary care physician may check, and others are a little more specific, kind of more rare. One of the limitations of NHANES is that it does not have neuroendocrine markers in there. So it doesn't have neuroepinephrine, epinephrine, or dopamine, which is commonly used in allostatic load research. So it would have been nice to have that, but that is the limitation of these studies because we did not have access to those biomarkers.
Did you look at anything related to snoring in adolescence?
Yes, we did. So what we looked at for measures of sleep is we approached it a couple different ways. One was there were a bunch of variables or questions about sleep quality and created a continuous score. So multiple sleep, we called them sleep disturbances or sleep problems. Then we looked at them individually to try to understand if there were specific sleep problems that were driving the association. And what we found was snoring was one of those drivers, particularly among those with immunometabolic dysregulation. The individuals that grouped in the immunometabolic dysregulation group, they were more likely to report snoring than the other groups.
Huh. Now, you also looked at short or long sleep duration, and I want to understand, I thought that was sort of normal in adolescence that they had, the tendency to sleep long periods, but is that a problem?
It can be. So part of the issue here is what we consider normal, right? And I would argue in some ways we have normalized abnormal sleep, right? So that what is normal, or might better say is typical for adolescence, isn't necessarily healthy for adolescence, if that makes sense, right? So what we looked at is short and long sleep duration as a variable here in terms of thinking about the weekday sleep. So our real question was, does getting a little bit of extra sleep on the weekend account for or help and kind of address not getting enough sleep during the week? So in other words, does that create kind of a protective factor for depression, right? And we found that it does, but we wanted to control for sort of abnormal or atypical sleep during the week. So that's what we included in there, is if students or adolescents and emerging adults during the week had kind of extended sleep periods or shorter sleep periods, and looked at that.
You also looked at short, late, and irregular sleep and how it's associated with an increased risk for depression. Now, is this new information or have we known that irregular sleep is tied to depression before this?
We have known this on some level, right? So it gets back to what I mentioned before, in that, there is a relationship there, and we're not able to really understand the directionality of that because this is cross-sectional. And I would argue that it goes both ways, right? Poor sleep leads to depression. Depression then results in poor sleep. But trying to disaggregate what that means, I think, is what we were trying to get at here, and understanding, okay, what does poor sleep mean, right? And that's where some of these markers kind of come in, and looking at short versus long duration, how that changes over time, and then also thinking about the late, early, midpoint. So are you going to bed too late and sleeping in too late because the timing of your sleep matters? Snoring, having low levels of alertness during the day, which is a marker of poor sleep quality. So we looked at those, and then the whole idea was, is weekend catch-up sleep, so a little bit of extra sleep on the weekend, does that help act as a buffer to some of those other sleep challenges? And does it act as a buffer and a protective factor for depression?
And did you find that it does?
Yes, it does. So the adolescents, emerging adults who had some weekend catch-up sleep reported lower levels of depression.
Interesting. Now, you've used the term emerging adults, so I'm wondering, for the research purposes, when does a person become an adult? Are you looking at that like around 25?
Yeah, that's a really good question. And there's lots of debate around this in the literature about terminology and you can look it up. Different groups have different definitions, but generally speaking, what we looked at, particularly 16 to 24-year-olds, and somewhere around that 23, 24, 25 is that transition. And a lot of that is linked to development and brain development. Right. So we know a lot in this space, but there's still some gaps in our knowledge. But yeah, there's not an agreed upon date. But generally speaking, we try to focus on a range that is overall accepted, generally accepted.
And does sleep generally become more regular in adults?
Again, I think it depends. I would say that the shift in what is considered healthy sleep and what is recommended occurs then. For our study, we used the cutoff for 16 to 17-year-olds of 8 to 10 hours of recommended sleep. And then for the other group, we had the 7 to 9 hours of recommended sleep. There's also changes that occur in the midpoint, circadian rhythms as you age. So there are changes that occur. But again, I think part of the challenge we have is what people consider quote normal sleep is, or we may call it the typical sleep patterns, aren't necessarily healthy. They're not one and the same.
What else would you like to learn about weekend sleep catch-up versus weekday weekend sleep duration?
So one of, again, the limitations that we had in this study in part was sample size. It was a good sample, but we weren't able to get down at as much of a granular level as we would have liked. So for example, we looked at any weekend catch-up sleep. And some of the other literature suggested that there might be a window that's good. So in other words, up to 2 hours is protective. But then once you go beyond that, maybe that's not, right? Maybe there are higher rates of depression among individuals who get more than 2 hours of weekend catch-up sleep. So as next steps, it would be interesting to look at that further and try to get a better understanding of what that optimum window is. And then also thinking about, okay, how does that relate to these other markers of sleep quality, particularly during the week, such as sleep timing, duration during the week, and such.
I want to be careful about jumping to conclusions, but do you think your findings could apply to adults who have depression? Would sleeping a little bit more on the weekends help them?
So, yes, I don't want to jump to conclusions either, but yeah, I mean, I think the takeaway, part of the takeaway here is thinking about sleep holistically and thinking about your overall quality of sleep, right? If you're getting poor sleep during the week, you're up late on your phone, you're having trouble sleeping, waking up, or you're snoring, right? Weekend catch-up sleep isn't the answer, right? You need to, address those underlying issues. If it's snoring, see your doctor. If it's maybe you need to change habits around your sleep habits, around phone usage in the bedroom, those sorts of things, right? Part of this is to just shine a light on the need to better understand sleep quality overall. And there may be situations where catch-up sleep may be a little bit beneficial for you moving forward, right? Some people may think, oh, well, I shouldn't do that. I shouldn't sleep in. Well, maybe sleeping in a little could be helpful for you.
Well, this is really interesting to think about, and I appreciate you making time to tell us about your work, Dr. Carbone.
Thank you for having me.
My guest has been Dr. Jason Carbone, a social worker and assistant professor of public health and preventive medicine and director of research for the Department of Family Medicine at Upstate. The Informed Patient is a podcast covering health, science, and medicine, brought to you by Upstate Medical University in Syracuse, New York, and produced by Jim Howe, with sound engineering by Bill Brokel and graphic design by Dan Cameron. Find our archive of previous episodes at upstate.edu/informed. If you enjoyed this episode, please invite a friend to listen. You can also rate and review the Informed Patient podcast on Apple Podcasts, YouTube, or wherever you tune in. This is your host, Amber Smith, thanking you for listening.